Welcome back, cat lovers. You know I'm all about those furry little anarchists we call cats. But even I gotta admit, sometimes our feline friends do things that make us scratch our heads and send our vets scrambling for their stethoscopes. That's right, folks. Today we're diving deep into the top 10 cat behaviors that make vets nervous. Those subtle or not so subtle signs that something might be a bit off in your cat's world. We're talking about the kind of stuff that sends up red flags, the kind of behaviors that make your vet say, we need to take a closer look at this. So, whether you're a seasoned cat guardian or a brand new paw parent, stick around, because understanding these behaviors could be the key to keeping your feline friend happy, healthy, and ruling their cat kingdom for years to come. We all know cats are meticulous groomers, but there's a big difference between a healthy lick and a full-blown grooming obsession. If you notice bald patches or skin irritation, it's time to take notice. Excessive grooming can signal stress, anxiety, or medical issues. Like us biting nails, cats groom to self-soothe. It's their way of gaining control. Excessive grooming is a furry flare saying something's not right. Visit your vet if grooming leads to hair loss or sores. Cats can be mysterious creatures, but they're not exactly known for their unprovoked aggression. So if your usually sweet and cuddly kitty suddenly turns into a hissing, spitting, scratching ball of fury, you know something's up. Sudden aggression is a major red flag for vets, and for good reason. More often than not, it's a sign that your cat is in pain, uncomfortable, or feeling threatened. Pain can manifest as aggression, especially if they associate that pain with being touched or handled. Medical conditions like hyperthyroidism, dental disease, or even neurological disorders can also cause changes in your cat's behavior, making them more likely to lash out. A new pet in the household, a sudden move, or even loud noises can all send your cat into a tailspin, triggering their fight-or-flight response. If your cat suddenly starts hissing, growling, swatting, or biting, don't ignore it. This isn't just a phase they'll grow out of, it's a cry for help. Your vet can help you determine the root cause of your cat's aggression and recommend the best course of action. We all know cats love to sleep, but there's a big difference between a healthy snooze and the kind of lethargy that sends shivers down your vet's spine. Lethargy is a general term that describes a lack of energy and enthusiasm. A lethargic cat might sleep more than usual, have a decreased appetite, show little interest in playtime, and just seem generally blah. Lethargy can be a symptom of a wide range of medical conditions, from minor infections to more serious illnesses like kidney disease, diabetes, or even cancer. It's like your cat's internal warning system is flashing red, but instead of a siren, all you get is a whole lot of nothing. When a part of that machine starts to malfunction, it takes a lot of energy to compensate. If you notice a sudden or dramatic change in your cat's energy levels, don't just chalk it up to old age or a lazy personality. Your vet can help you determine if your cat's lethargy is a sign of an underlying medical condition, or simply a case of the blahs. They'll perform a thorough physical exam, run some blood work, and maybe even recommend some additional tests to get to the bottom of your cat's sleepiness. Cats are masters of disguise. They can disappear into a cardboard box, blend seamlessly into a pile of laundry, or vanish without a trace behind the refrigerator. But while the occasional disappearing act is normal for our feline friends, prolonged or excessive hiding is a behavior that makes vets raise an eyebrow. Cats thrive on predictability and feel most secure when they know what to expect from their environment. So, when a cat suddenly starts hiding more than usual, it's often a sign that something has disrupted their sense of security or that they're not feeling their best. Hiding is their way of seeking refuge from a world that suddenly feels overwhelming, scary, or just plain uncomfortable. The reasons behind a cat's sudden desire to disappear can vary widely. It could be something as simple as a change in routine, like a new house guest or a furniture rearrangement, or it could be a sign of an underlying medical condition, like a urinary tract infection, dental disease, or even arthritis. Your vet can help you decipher the clues and determine if your cat's hiding behavior is a cause for concern. Let's be real, folks. Cats vomit. A hairball here, a grass blade there. It's all part of the feline package. But there's a big difference between the occasional offering on your rug and the kind of frequent or chronic vomiting that sends your vet into diagnostic mode. Persistent or recurrent vomiting can be a sign of a whole host of underlying medical conditions, from digestive issues to infections to organ dysfunction. When something disrupts that balance, whether it's a foreign object, a food intolerance, or a more serious medical condition, vomiting is often the first sign that something's amiss. If you notice a pattern, if they're vomiting more frequently than usual, if the vomit contains blood or has a foul odor, or if their vomiting is accompanied by other symptoms like lethargy, loss of appetite, or diarrhea, it's time to schedule a visit with your vet. Your vet can help you determine the underlying cause and recommend the best course of action. We all know cats can be finicky eaters, but while the occasional bout of picky eating is normal, a sudden and significant change in appetite, whether it's an increase or decrease in food intake, is a red flag that shouldn't be ignored. Your cat's appetite is a barometer of their overall health. When they're feeling their best, their appetite is usually consistent. But when something disrupts their internal equilibrium, their appetite is often the first thing to change. A sudden increase in appetite can be a sign of hyperthyroidism, diabetes, or even intestinal parasites. On the flip side, a decreased appetite can be even more concerning. It's a common symptom of a wide range of illnesses, including infections, kidney disease, cancer, and even stress or anxiety. If your cat is refusing food for more than 24 hours, it's time to call your vet. Your vet is your best ally in deciphering your cat's cryptic clues and ensuring they receive the best possible care. Cats are known for their enigmatic meows, but sometimes our feline friends turn up the volume, transforming their gentle meows into a relentless chorus of demands, complaints, or even mournful cries. Excessive meowing, especially if it's a sudden change in their vocal behavior, is a signal that often sends vets scrambling for their stethoscopes. Cats use a complex language of tail twitches, ear swivels, and subtle body postures to convey their thoughts and feelings. So when they resort to excessive vocalization, it's often a sign that something is amiss. Excessive meowing can be a sign of stress, anxiety, cognitive decline, or even an underlying medical condition causing them pain or discomfort. For example, hyperthyroidism can cause increased vocalization, along with weight loss, increased thirst and urination, and a racing heart rate. Urinary tract infections can also lead to excessive meowing, as they strain to urinate or cry out in discomfort. If your cat's meowing is out of character, persistent, or accompanied by other changes in behavior or physical symptoms, it's time to consult with your vet. Your vet can help you determine the underlying cause and recommend the best course of action. Cats are graceful creatures, known for their fluid movements and effortless agility. So, when your cat's graceful strut turns into a limp, you know something's amiss. Limping indicates something is interfering with your cat's ability to move comfortably. Persistent limping is a red flag that warrants a trip to the vet. The musculoskeletal system is a complex network allowing fluid movement. Injuries can manifest as limping or lameness. Let's talk litter boxes, folks. It's not glamorous, but it's essential for our feline friends. Paying attention to the litter box can reveal insights into our cat's health. Cats are creatures of habit, even in their bathroom routines. Changes in urination habits signal issues in their urinary tract. Consult your vet to decipher the clues in their litter box. Let's face it, folks, no one likes to talk about diarrhea, especially when it comes to our beloved feline companions. But as much as we might want to avoid this unpleasant topic, it's an important one to address, especially since it can be a sign of a whole host of health issues in cats. Cats are creatures of habit, and their bowel movements are no exception. So when their digestive system throws you a curveball in the form of diarrhea, think loose, watery stools, straining to defecate, or even accidents outside the litter box, it's a clear sign that something's disrupting their internal harmony. Diarrhea can be caused by a wide range of factors, from dietary indiscretions to more serious medical conditions like infections, parasites, food allergies, or inflammatory bowel disease. If your cat's diarrhea persists for more than 24 hours, if it's accompanied by other symptoms like vomiting, lethargy, loss of appetite, blood in the stool, or if your cat seems to be in pain, it's time to schedule a visit with your vet. Your vet can help you determine the underlying cause and recommend the best course of action. So, there you have it, folks. 10 cat behaviors that should send you straight to your vet's speed dial. Remember, cats are masters at hiding their pain and discomfort, so by the time you notice something's off, it's crucial to take action. Don't try to diagnose your furry friend yourself. What might seem like a minor quirk could be a sign of a more serious underlying issue. Your vet is your best ally in deciphering your cat's cryptic clues and ensuring they receive the best possible care. Thanks for watching. If you noticed any of these behaviors in your cat, it's always best to consult with your vet. Don't forget to like, subscribe, and hit the bell icon for more cat care tips.